Welcome to the Healthcare Matters podcast, bringing you the latest insights and innovations shaping the future of healthcare. This episode is powered by Medlab Middle East in partnership with World Data Exchange. I'm your host, Peter Birch, and today we're discussing the challenges of fragmented healthcare systems and how digital transformation is redefining how patient data is managed and shared globally. Joining me are two guests, Paul Camillos, Program Management Officer at World Data Exchange. He's a senior technology leader with over 30 years of experience bridging commercial needs and technology to drive value-driven outcomes. And also joining me is the Honourable Ken Wyatt, former Australian Federal Minister for Health, who has seen firsthand the complexities of health governance and the role of innovative solutions like HIX can play in transforming healthcare. Together, we'll explore how fragmented health data impacts patients and providers, the opportunities that solutions like HIX create for better outcomes, and the road ahead for governments and healthcare innovators. Hello, Paul and Ken.
Hi.
Hello, how are you?
Great to be with you.
It's great to be with you as well. I'm looking forward to diving into this topic. Before we really get to understand this framing around HIX, I wanted to understand your backgrounds a little bit more and what you bring. So, look, we know that healthcare systems around the world are grappling with fragmented data, with rising costs and inefficiencies that impact both patients and providers. From your perspectives, why is solving this data problem such a critical priority right now? And what's at stake if we don't address it? Paul, I might start with you.
Thanks, Peter. I think the biggest issue with the fragmentation of data is that medical technology in and of itself has advanced so much over the last 2 or 3 decades. The results that can be gotten from medical monitoring today would have been like magic 30 years ago. But even though health records are digitized, they're sitting in computers or cloud services somewhere, they're fundamentally the same old record approach as we had decades ago. 50 years ago, your GP had a bunch of little cards that had all your details on them. They'd add another card and add another card. This is what they're doing with the digital records. And they sit with that individual healthcare provider, be it a GP, specialist, hospital, whatever. And there's no interconnectivity with that information. So that means what my GP knows, a specialist doesn't necessarily know. Or if I'm admitted to hospital, that information isn't shared with the hospital. So they have to go and redo tests and ask the same questions and ask me, are you taking medication? If you are, what is it? What doses, etc. If we can combine this information into one database about me, the ability to be able to rapidly address all those questions and also not request unnecessary tests, because if I'm admitted to hospital, they may ask to do a test that my GP may have done a week ago. So these are the sorts of opportunities to be able to get better health outcomes for the patient that comes from addressing this data fragmentation.
Well, yes, I mean, gone are the days of the manila folders and bits of paper, but if we're just putting online manila folders and bits of paper, then I'm not sure we're really addressing the issue. We're addressing one issue, but not all of it. But Ken, you would have obviously seen this evolution over time. What's your take on this point?
I think one of the challenges we've got is that the healthcare system, doesn't matter where we are globally, is a federation of different healthcare providers. You have a mix of government, non-government organisations, you have private practices, and then you have businesses. And because of that, you have this ownership of data that prevails across all those providers, and they hold that data very jealously. Whilst we talk about patient-centred, it's not. It is really about the medical practitioner-centred model that suits them. Now, paper files still exist. If you go into hospitals, you'll see the specialist or the doctor will come in with your folder. It'll have all the detail. It would be far easier if that had been digitised and they were able to share that data with you and you had access to owning the data around you. And the point that Paul makes is when you go into hospital and you take a multi-pill approach to your chronic condition, people forget what medications are on. If a doctor is able to look at what it is on your data vault, then they can see the type of medications, the strength, etc. But governments have to grapple with the federated model in health. And that is one of the most significant challenges that all countries face, regardless of where you are. And the other is the mindset of the professions. There are people who, in my age bracket, didn't grow up with computers, but we use them. But for some, they struggle with it. Others, and particularly the millennials and younger, are absolutely whiz kids on technology, inserting data and making sure that it is accurate in there and the level of detail. So we've got this spectrum of skills. So there are challenges, but I'm optimistic that we are coming and bringing together health systems in a very different way, given technology and given AI, which is now evolving substantially.
Well, yeah, no, there's some exciting times ahead, and you're right that healthcare shouldn't necessarily. It's not a transactional affair, is it? It's not every new consultation needs to take into consideration all that information too, which makes it so unique and such a challenge. Like you say, wherever you are in the world. Paul, I want to come back to you because I know you've spent a lot of time, decades, working in the intersection of technology and governance and business outcomes. Love to learn a little bit more from you on what's led you to focus on this healthcare data challenge and how HIX or HIX is positioned to address this deeply entrenched problem.
Okay. Well, I think one of the things that really has attracted me to the healthcare space is it's an area where you can actually have a substantial impact. You can create benefits for people with if the technology is deployed appropriately and you develop the appropriate technologies. And it also gives me an opportunity to utilise some of the skills and disciplines I've learned in other industry sectors and apply them to that healthcare area. And I think the ability to be able to assist with providing better healthcare, I mean, let's face it, it affects all of us. Me too. So, that's one of the key reasons why I've chosen to focus on this area. And HIX provides a number of different solutions to this problem of fractured data, but also improvements in the way medicine is delivered. But I'd like to, if I can, just take a second to talk about a real-world example that came up in conversation just a couple of days ago. I was speaking to someone who's got what they classify complex medical issues. And they said that one of their specialists had retired just recently. And until they find a new specialist to take on their case, they can't get access to their own records. Because without a specialist to request those records and get them delivered to the new specialist, those records are unavailable to this individual. And the problem is the wait time to get to a specialist to to decide, okay, I want to use you as my specialist, and then them get the records. We're talking months. 6 months is not an unrealistic time frame for that to occur. So HIX as a product combines three components. It has a personal health vault. This is where and I'll use myself as an example, this is where all my medical records will be stored. From my GP, specialists, surgeons if I've had surgery, and any other medical provider. What we've done with that is we've put a very high level of security around it, so as to make sure that it does stay secure. Then we've built on top of it a medical viewer. So what that does is it takes the data that's inside the vault and presents it in an easy to understand fashion. So you can look and see your appointments, your medicines, your prescriptions, etc. And on top of that, we've added a third component, which is called an international patient summary. And that is, it takes that information from the vault of the medical viewer and presents it in a standardized manner that allows your medical history to be viewed and made available internationally. So let's say I travel to Japan, it's laid out in a standardized format, the information is laid out in a standardized way. That means if something happens, a medical facility or a doctor in Japan should be able to look at that and understand my conditions and my medical history to be able to respond appropriately. So by having with HIX having all that data in one location, secured, I have all my medical history with me. It is no longer a case of, oh, you've got to call my GP for this or this specialist for that. That leads to better health outcomes for myself, reduces the costs involved in providing that medical support, and it also provides opportunities for new devices to be able to provide more information easily and quickly to the patient.
Well, that's right, and it's something that anyone would think about their own healthcare experience and how much time they might spend, and also providers too. If you're crossing different modalities or clinicians, to be able to collect information from other providers or do retests and just to gather the basic information you need. It feels like a no-brainer that we all need that kind of centralized view. But Ken, firsthand, because you've got extensive experience in both healthcare and government, that we've identified these challenges, in Australia, and it has been identified in other parts of the world too, that this is an issue that needs to be addressed, and it is still an issue that we face, and we're not short of attempts to try and bring together like a unified, secure, and accessible view of patient data, but it has been a challenge. How do you reconcile this challenge and perhaps see how solutions like HIX could help governments in making meaningful progress in this area?
See, what you need is strong leadership from either a Commonwealth Minister or a state or territory minister in Australia who says, we are one country. What we should have is a system that enables the transfer of data between all jurisdictions and all health site locations. But the challenge we have is that each state and territory will believe that their system is the best model and that the others should adopt theirs. So part of the thinking that has to occur is, how do we redefine the scope of data that we require to provide a population health approach, but at the same time allowing the transportability and operability of data in any location around this country. The other challenge, of course, is with technology, is the state of equipment and systems that are in play. And there has to be a consideration for a uniform one, whereas HIX does that. It has all of the data collected, retained by the individual. It has two keys to it. The key that the individual gives approval for, a second key to open the data when they visit their doctor or a specialist or a dentist even, who can then see the treatment the individual has had. And Paul covered and touched on this point, because when you have that access to data, then you can make decisions that take into account the safety of the patient with any treatment that you provide in this process. We've still got a long way to go, but there is good intent by health ministers, but it's going to require significant funding, because the systems you have will have to be compatible right across this nation. Now, we've developed our system where the compatibility and operability interfaces with platforms of a very different nature, which would make it easy for any individual to access and to use, not only in our country, but also globally. It's the wherewithal, It's strong leadership, but it is also a commitment to resources that is a long-term investment. So you can't fix everything overnight. What you have to do is think about what's a 3-year approach that we can bring all of our systems to a point in which they interact and provide accessibility to every individual in this country or every individual in any country. And think of America, 50 states. That'd be a bigger challenge. And again, you're dealing with state governments in those jurisdictions who guard their systems as jealously as being the best that is in place. And you don't want outsiders interfering with it. So, but there's opportunity, and I remain optimistic with what we're doing as a way forward for everybody.
Well, that's so true, isn't it? It's definitely not just a technology problem. It's a relatively straightforward technology problem. It's all those extra elements that make healthcare much more complicated, particularly in a global landscape. I also think about other points around healthcare and what makes it unique is, we've talked a fair bit about the what happens within a consultation at a point in time in health. Like you go in to see a clinician and then records get updated when someone visits a doctor. But there's so much healthcare that happens in between consultations, like in between visiting a doctor, that often is missing and could give a lot of context. I'd love to know if HIX addresses this problem. We might start with Paul, and what kind of opportunities does having continuous data aggregation create for healthcare providers and the device manufacturers or even patients themselves?
Yeah, it's actually a real key point. HIX has been built to allow individuals to be able to pull data into their personal health vault from multiple devices. So I notice you're wearing an Apple Watch. It's got the 3 rings, which tells you your activity and how much you've done in terms of standing and walking, and you can also get exercise, heart rate information, etc. That information can be pulled into HIX. So, as can information from home blood pressure monitors, for example. So what that means is that when you go to a consultation with your GP, in your vault, that information around your activity, etc., blood pressure, etc., is all there. The GP has the ability, because you've shared that information with them, to be able to see what's gone on since the last visit, to understand. Or if you're, someone who's younger and you're fairly healthy, they can say, okay, what's happened in the last 3 weeks? You said you were starting to not feel well in the last couple of weeks. So let's have a look over the last 3 weeks of data. What's gone on for you? Let's try and see if we can understand if there are any indicators there that can help us narrow in on what's causing your issue. And because that information is held in a personal data vault, which can be exchanged over the network, that information is also available to your GP if you're doing a telehealth appointment, which is something that just is unavailable at the moment. And a telehealth appointment is just, how are you feeling? What's going on? Oh, I felt dizzy, or whatever it could be. This gives the doctor an opportunity to see a much richer amount of information about the patient that they're talking to be able to assist them in getting the right sort of health outcome. And the opportunities for device manufacturers is that patients and individuals are going to be more likely to want to go out and buy a device that allows them to be able to pull this information into their personal health vault and make it available to their medical providers in a way that makes it easier for them to understand what's gone on. And particularly at the moment, there's multi-sensor devices starting to come onto the market where they measure, it's not just a blood pressure monitor, it also measures blood oxygenation, your heart rate. And so being able to combine all of that into one device, have the data stored, and be able to share it with your medical providers in a timely manner gives a whole range of opportunities to those manufacturers as well to be able to design new devices and make them, tailor them to be able to provide the information that healthcare providers are after.
It's funny you call out the Apple Watch. It's a glorified phone finder for me primarily because I keep losing my phone and need to ping it. No, there is really good health information that's captured on there, but that's probably the core use. But actually, I wanted to bring that up specifically, Ken. I'd love your perspectives on this same question too, because, when these devices first came out, I remember clinicians weren't so interested in the insights that came from them, whether it be because it's new technology or because of the accuracy or probably a number of factors. Like, they don't want to know how many steps you took or anything like that. But I guess fast forward to now, the accuracy, the breadth of the information, and I guess the sentiment and the digital literacy for patients and clinicians has probably evolved quite a fair bit. How do you see the importance of that information between consultations?
Actually, I think there's a couple of things we've got to consider in this. One is preventative. Whilst we buy an Apple Watch or a Fitbit and we wear it, we certainly take note of the number of steps and we enter into conversations. And as you have conversations with friends who've got them, they then say, what's your heart rate like? And you start conversations around patterns that are emerging with the device that you have. And then ultimately you go to your doctor and they ask you a series of questions. Have you noticed any change, or have you had heart pain or whatever? And you're able to say, well, my Fitbit has been showing some concerning issues. Can I share them with you? And that's why I think the medical profession have now taken significant note of the devices that allow people to monitor their bodies on a daily basis. Even when they're exercising, you can see if your pulse rate increases, your heart rate, and the settling heart rate as well. I think the other thing is that we will see these to be extremely useful in emergency departments as more elements come into play. So the temperature, your body temperature, if you're sitting in ED and you know that you feel as though you've got a fever, you'll be able to look at your instrument and see that your temperature is now hitting 39.2. And if that's connected into an ED, then they should have that as an alarm that says that patient in the corner, we need to see them, their temperature's rising. So there's very practical elements to the instruments that we're now starting to take for granted. And this fits with the way in which our Vault will record and store data, but allow you to have longitudinal data that you can show very clearly a pattern that might be emerging. Because it's always fascinating when you talk to a family and all of a sudden they have a child that has an irregular heartbeat, but they never ever picked it up. And it's only through a device that they start to see a pattern emerging. I think the other thing that's good about these devices is eventually you will see people starting to include other allied health professionals in accessing that information. So if you are a diabetic and you've got a foot problem, you'll go to a podiatrist, they'll be able to see the data, and then it'll either raise concerns or they'll just treat the foot accordingly. But it might be an indicator that there's an ulcer forming, which you can then treat and prevent gangrene and the removal of a leg from the knee down. So there's a preventive element to this that excites me in terms of there's great opportunities to have a healthier population. Your generation are going to gain substantially from the way in which data is owned by you, that you can use it and you can negotiate the treatments. Because in the long term, those decisions will be between you and your doctor, but you have a say in it this time. And I think that's the shifting pattern that we're seeing in this country. Paul and I are of an older generation where we remember the cards and the bits of paper our GP kept, but that can never be transmitted to another doctor. So if you shifted from where you are to another town, you had to apply to have your records sent. And it depended. The doctor could say, no, they're my records. So this changes that whole dynamic.
Yeah, no, that's a deeply entrenched mentality, and it's good to see that shifting. And I think you're right on the money in terms of those conversation starters, that having visibility of that data, and I'm reminded that what gets measured gets managed, or all of those terms. So that's super important. But then typically, Paul, in these conversations that we have about connecting different healthcare information, often interoperability is flagged as a major roadblock in healthcare technology. I'd love to learn how HIX can bridge the gap between different systems and data sources to help us create that unified portal of health information that you're talking about. But then when we think about that, we've got to also make sure that it's, the privacy concerns are addressed and informed consent remains at the front. There's a lot of moving parts.
Absolutely, there is. So one of the approaches that we've taken is, rather than trying to understand the data structures for each of the devices that are out there, we pull it in and we map it to a standard data format that is widely accepted through the healthcare environment. It's called FHIR. And what it does is it provides us with a standardized set of health information relating to the individual. Then, when that information is queried, it goes out in that standardized format. Now, the system that's receiving the information, if it internally uses something else, it still understands this standardized format coming in. It does its own mapping to bring the data into the way it likes to consume it, and then it does what it needs to do. So we're trying to become, I know this sounds a little bit crazy, but we're trying to be like the Rosetta Stone of medical data. And in terms of the privacy, it's something that we've built into the product literally from the ground up. What we've done is we've built a consent engine into the product that sits on top of the health vault. So if I go to my a new GP, they request access to my data. I look on the screen of my device, my phone, and it says, this doctor wants to see this information of yours. So it actually lists what. And if I'm happy with that, I slide across the slider on the screen to say, yes, I agree to share this information. And then the data interchange takes place. So that means no data leaves without my approval. And also, if I'm not happy with something that they're asking about, I don't have to give my approval. Or I can query them as to why is it that you're asking for this information. So that takes care of that part of it. And of course, the other part that we need to discuss is there's bad actors out there who are constantly trying to get access to what is very rich personal information about individuals. And what we've done is we've kind of tipped this whole process on its head. Generally, these bad actors want to go out and try to access data sets that have the information of millions of people, because it costs them to break into these systems. There's a cost, so there's a risk-reward equation that they take. Because the health vault only holds my data, that risk-reward goes away, because we've got to spend a lot of money and a lot of time and a lot of effort and a lot of risk to get one person. And then we've got to go do it all again for the next person and then the next person, rather than let's go find somewhere that's got 1 million people and let's try and get that so we can pull that information. So the way data is currently stored in medical systems also increases the risk to the individual.
Yeah, that's right. It's just it is interesting to think about that prospect of having that information isolated to address an issue that I know keeps a lot of CIOs, decision makers, and anyone, even patients, up at night thinking about where their information is going. So an important one to address. One other thing that I'm thinking about, because earlier we spoke a little bit about the international patient summary, and Ken, I'd love your perspectives on this a bit more too, because healthcare is global, and especially for travelers. And I think about my own experiences. You don't everyone's just used to, if you were going to receive healthcare in another country, you're basically starting from scratch. But something like an international patient summary could really change the game for individuals that are trying to navigate healthcare systems across different countries. But it feels like if we can't get it right in an individual location, being able to do that across the world, is it a bit of a pipe dream, or is it something that we can really look forward to one day?
No, we can look forward to it, because what we've developed enables that. It's the capacity of people to want to take it up. I certainly will be taking it up, because when we travel, and whether it's for work or for a holiday, often we think that every day is going to be fine, and then some event happens that just changes that moment in time for us. I think of the little fellow that was run over in New York by a taxi, an accident. That means his records are not available for the treatment that he will receive. So the doctors there, based on what they see, will guess that he's a healthy young fellow, that his medical condition should be automatically stable. What they won't know is if he's got a particular illness for which he's receiving medications that may be blood thinners, for example. And so they do surgery and then suddenly realise you've got a patient who's on a blood pressure or a blood thinner, and that creates problems that they have to respond to immediately. But even as an individual who has a fever, becomes seriously ill, if you're able to access their data, you might get a sense of what is causing that or what the problem is. Cardiovascular, you'll get a sense of whether the person's had stents, prior treatment in their own home country, and the medications they're taking. So as the treating team, you've got the information right there. It's like having the blueprint plan of anything that you build, but applying it to the human body in terms of treatments and medications they're having makes an incredible difference as to how you then respond to the crises for that international patient. So think of every pilot, every airline hostess who travels around the globe. If one of them becomes ill in another country, they will have their international patient record. And that will allow them to have the right treatment for the right reasons, but takes into consideration their existing treatment, particularly as we get older. And then, of course, elderly travellers who are travelling, who become ill, a doctor in another country can then see what their treatment has been, what their illness has been, and what's evolved over a period of time, and make the right decision. It really goes to patient safety, patient care, but high quality care with the right data readily available at your fingertips to make those decisions.
Yeah, look, it's powerful potential and like a worthy cause for us to pursue, not without its challenges. We talked a little bit about the fact already that this is a much more than a technology problem. We need that cultural and operational and policy shift. I'd love to hear from both of you. I know, Ken, you unpack this a little bit, but maybe to round out, but particularly Paul, what do you see the biggest hurdles in driving adoption of a solution like HIX, and how can governments and healthcare providers and patients all work together to overcome them?
I think that the key component here is education. Not only and in understanding that doing this doesn't actually take any of the anything away from the medical providers or from government. What it actually does is puts them in a better position to be able to provide the outcomes that an individual wants. And I think what's occurred is over time, you'll hear from medical professionals, each one of them will say, the patient is at the centre of our world. And the operative part of that is our world. So they are at the centre of the GP's world and the centre of the dentist's world and the centre of the hospital's world individually. What they haven't done is actually linked up to make the patient the centre of the healthcare world. And there's going to be a requirement for education in that, and it's also going to require education for the individuals, for the patients, to be able to say to their doctors, hey, I know this is out there. I want this because it's going to help me keep my health in better check. So it's got to be driven from both directions. There's got to be the education to the healthcare providers and government, but also to the individuals, so they know this exists and it's good for me, it's good for everyone. So how can we get it? When can we have it?
Mm. Such great framing of, the only world that exists to a patient is theirs. We're not in a weird superhero multiverse setup. That's too confusing and not something that would be interesting to patients. No wonder we don't have that engagement. But Ken, it seems like you agree with that as well.
Look, I think the education of the population is critical. Developing an awareness of a product that's there, something that's going to change their life, make it easier. I hate it when I go to a GP and then I happen to be sick in Melbourne and I have to go and see a GP for some treatment and I have to repeat everything again. And if you go to hospital, you repeat the same information. And I just find that frustrating because I might make a mistake or because I feel really ill, leave out some important information, which is critical to how I'm treated. But education, I agree with Paul, education of government, education of the healthcare system, and education of the population. But I would frame it for the population as you have a choice. And you can choose people who give you the right to own your own data, who give you the right to be part of the solution to your treatment by saying, well, doc, I have this problem, but that medication is not working for me. Can we talk about it? And here is the information that you can see what it is. Because I have a niece who's a pharmacist and she works in a significant hospital here in WA, and she talks to me frequently about going around looking at patients' medical charts and finding that medications prescribed are not the right ones for them because they are contradicting another medication they're having. As an individual, I don't know that. But she, as a specialist, is able to pick that up, and a database that you own and control will help you ask the right questions. Are these medicines the right ones for me, doctor? Or your cardiologist, are these the right treatments? And that choice in that process should help us to live much longer. And I'm hoping in the future that we see a lot more people live to 120, not the 90s, 120 plus, so that you have quality of life because the treatment you're getting is the right treatment and the most appropriate treatment, that you have a say in it and you own your data and you can share that anywhere.
Yeah, it's going to be critical to bring the patient, the population, along with that journey to make those informed decisions and raise that education and awareness. So exciting potential and a long road ahead. But thinking about that forward projection for a little bit as we start to round out this conversation, I'd love to hear from both of you about what does excite you most about the future of healthcare data integration and digital transformation, or perhaps if there was one key message you'd like the listener to take away from this conversation, what would that be? Perhaps Paul.
For me, I think it's for the individual who's listening to this to understand that having all your data provides you with the ability to get much better healthcare outcomes. As Ken said, at living to 120 and with quality of life is a possibility. But that's not going to happen until you've got the ability to have that information. And then if you couple that with the advances that we've had in medical technology, and that keeps happening. I mean, I said it before, some of the devices that we have today, 20 years ago, people would be saying that we can't do this. It's fantastic to even think that something like that could exist. Imagine what the next 20 years is going to be like. But we need to be able to utilize the data that those devices generate to get the right outcomes. And I think that's probably the most exciting thing for me.
Yeah, it's an inspiring one. Ken, anything else to close us out?
Look, I think the exciting thing is I will own my data. I will have a choice of using devices to show me a pattern of my body as an operating machine or as a temple. I can then make those judgments. And I also believe that the medical profession will follow. And I believe that health systems we'll see the cost efficiencies and the time reduced in people occupying beds in hospitals, because we have been in a preventative mode as opposed to a reactive mode of being treated after you're diagnosed. So pre-diagnosis is the key to living longer.
Great message to leave out on. Thank you, Ken. Thank you, Paul. I appreciate your time in this great conversation that we've had to unpack the challenges of fragmented health data to the transformative potential of HIX. I feel like we've kind of uncovered a bit more how digital transformation can drive better outcomes for patients, for providers, for governments, for all the stakeholders. So really appreciate you making the time. Thanks so much for speaking today.
Thanks, Peter.
Pleasure.
And thank you to Medlab Middle East in partnership with World Data Exchange for supporting this episode. And remember, if you've enjoyed today's discussion, don't forget to follow Healthcare Matters, the podcast on Spotify and Apple Podcasts to stay ahead of the latest healthcare innovations. I'm Peter Birch. Thanks for tuning in and see you next time.